If you believe you may have been exposed to asbestos, you may be wondering if there are medical tests that are able to tell whether or not you are at risk for mesothelioma or asbestosis. The answer is yes and no. In the first place, virtually everyone in the U.S. today has been exposed to asbestos to some degree. Asbestos is a collection of naturally occurring silicates, similar to stone. Asbestos particles are present in the air we breathe, albeit in very low concentrations, less than 1 part per million. If you suspect that you have been exposed to high levels of asbestos, there are several ways to confirm it. Asbestos exposure can be measured by analysis of the urine, feces, mucus, or lung washings. The lungs are literally washed out with a saline solution. Unfortunately, there is no way to determine whether or not a patient will actually contract a disease from such exposure. You know what I was doing? I was looking a sentence ahead. Damn. Right from the beginning?
Yeah.
All right.
Well.
Yeah, I know.
Okay, restart.
If you believe you have been exposed to asbestos, you may be wondering if there are medical tests that are able to tell whether or not you are at risk for mesothelioma or asbestosis. The answer is yes and no. In the first place, virtually everyone in the U.S. today has been exposed to asbestos to some degree. Asbestos is a collection of naturally occurring silicates, similar to stone. Asbestos particles are present in the air we breathe, albeit in very low concentrations, less than 1 part per million. If you suspect that you have been exposed to high levels of asbestos, there are several ways to confirm it. Asbestos exposure can be measured by analysis of the urine, feces, mucus, or lung washings. The lungs are literally washed out with a saline solution. Unfortunately, there is no way to determine whether or not a patient will actually contract a disease from such exposure. Early symptoms and detection. In order to confirm whether or not mesothelioma is present during its earliest stages, Stage 1, localized, a thorough physical exam and special diagnostic tests are required, in addition to chest x-rays and CAT scans. In its earliest stage, mesothelioma manifests itself as a series of tiny bumps on the surface of the pleura, the membrane that surrounds the lungs. These tiny bumps are called nodules, and typically they do not show up in x-rays until the disease has reached a more advanced stage, at which point they have become substantially larger. As with many respiratory diseases, mesothelioma causes chest pains and breathlessness, as well as a nagging, persistent cough and corresponding hoarseness of the voice. In its peritoneal form or abdominal form, mesothelioma can cause abdominal pain and swelling. In addition to these specific symptoms, mesothelioma produces more generalized symptoms that are common to many different cancers and related illnesses. Night sweats, unexplained weight loss, chronic fatigue, and loss of appetite may be due to any number of pathogenic conditions. It requires a battery of specialized tests to determine the specific cause. If you believe your symptoms are indicative of something more serious, your first step is to schedule a full physical examination with your family's primary care physician. He or she will need to know your entire medical and occupational history before proceeding. Your analysis will be performed. If there appears to be any unusual noises in the respiratory system or tests show diminished lung capacity, your physician may order a chest x-ray. If this x-ray shows any abnormalities, you will be referred to a specialist who may order a CT scan. Advanced diagnostic techniques. The CT, or computerized tomography scan, is a series of x-rays taken from different angles so as to create a three-dimensional picture of the internal organs. Generally lasting 30 minutes or less, a CT scan involves a small amount of radiation exposure, but not enough to be health-threatening. If you are scheduled for a CT scan, the specialist will instruct you to refrain from eating and drinking for at least 4 hours prior to the procedure. Immediately prior to the scan, you may be given an injection of an iodine-based dye that will make certain parts of your internal anatomy more visible on the scan. There are side effects associated with this, usually consisting of a feeling of heat throughout your body. If you are asthmatic or allergic to iodine, it is vital to give the physician this information prior to the CT scan. Thickening of the pleura and peritoneum and excess fluid in the chest and abdominal cavities will become apparent in a CT scan. However, these can be symptoms of any number of disorders. Determining whether or not mesothelioma is the cause require additional tests. One of these tests is called pleural or peritoneal aspiration. This procedure involves the insertion of a special kind of needle syringe into the chest or abdomen, which is then used to draw fluid. Again, chances are that you as the patient will be sedated before this is done. It is really quite painless. Once a sample of this fluid has been obtained, it undergoes a lab analysis to determine whether or not it contains cancerous cells. A biopsy is another diagnostic method for determining if cancer is present. This is the process of obtaining an actual tissue sample from the area in question. A core needle biopsy can be performed, which is done either by a surgeon or a radiologist. This requires only local anesthesia and insertion of a needle. While the patient is under general anesthesia, the surgical oncologist will pass a small tube through the skin of your chest or abdomen, which has a miniature light and camera mounted at the end. This device is called the endoscope. It is used to collect small tissue samples, which is then examined by a pathologist in the lab under a microscope. Even under examination, the oncologist may not be able to make a final determination as to the nature of your illness. The sample may be sent off for examination by other labs in order to confirm your oncologist's diagnosis. In some cases, tests may need to be redone, or you will be advised to seek a second opinion. In any event, test results may take several days. What to do in the meantime? During this time, it will be natural for you to feel apprehensive. It may be helpful to share your feelings. If you are not comfortable talking to a friend or family member, you may wish to consider contacting one of the many cancer support groups in your community or online. The National Cancer Institute at 1-800-4-CANCER can put you in touch with such a support group. In addition, they have cancer specialists on duty Monday through Friday to answer any questions or respond to any concerns that you may have. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.